Thank you for joining us for this edition of Pagosa Local News. My name is Gabrielle Dorr. I'm here with Dr. Dave Shaeffer from Pagosa Medical Group. He is the co-owner and surgeon here. Today we're actually practicing social distancing, so we're 6 feet apart from each other, and we're going to give you an update on how things are going with coronavirus in our area, Archuleta County. Thank you for joining us today.
Thanks.
So you're going to give us an update on testing in Archuleta County and what has changed since the last time we talked to you.
So it's been about 10 days since we last talked, and the changes to testing have unfortunately not changed much at all. The criteria for testing, who we're going to test, is pretty much the same. We are only testing people who have symptoms and are either a healthcare worker or they're in a high-risk group, meaning they're over the age of 60 and they have other medical problems that might put them at risk of getting really sick from this virus if they were to catch it. So essentially, we're not testing people who have no symptoms, which is an important thing to note. We've had a lot of phone calls from patients that just say, hey, I want to test. I want to know if I have this. Well, if you don't have symptoms, we're not going to test you. Unfortunately, there's a lot of patients who have an illness of some kind, some viral illness, whether a cold or a flu. Could be COVID-19. We really can't say right now, but unless they meet that criteria, we're not testing them. And it's not that we're being stingy. We only have so much testing we can do. We only have so many swabs. The labs themselves can only run so many tests at once. And right now, we're reserving those tests for people who really could benefit the most. Recently, San Juan Basin Public Health in La Plata County at the fairgrounds on Friday and Saturday did have a drive-up testing facility. But that was limited in number because, again, we only have so many tests and we only have so much personal protective equipment or PPE. And the people who are taking the test, who are taking the swabs, need to be in full PPE. And even if we had an unlimited number of tests, we can only test as many people as we have PPE. And right now we're very limited with that. We have tested people here in Pagosa. We have no positive tests to date in this county. There are tests that are pending, and unfortunately, as we mentioned last time, the turnaround time on these tests can be days, can be 5 days or longer, and that's not up to us. It's just the labs are backed up, and that is a national problem, and it's a local problem, and it's where we stand, and there's nothing we can do about that right now.
Right, and so you were saying that just, it's not that that COVID-19 isn't necessarily not out there right now, but just that we just to stay vigilant and practice social distancing.
Right. So right now we have no positive test, but we have to assume it's out there. And that's why we are telling people if they're sick, they need to stay home. That's why we have all this social distancing that we are practicing now, with restaurants being closed to everything except takeout and delivery. We're encouraging people to not gather in groups greater than 10. The schools have closed, which is an excellent step that has been taken. So these are all important things that, because our numbers are at or close to zero, that maybe we as a community can keep this from ever blowing up like what we're seeing in large metropolitan areas like San Francisco, Seattle, New York, and New Orleans.
You wanted to tell us about how telehealth and how that's working for the community and who's doing it, that kind of thing.
Right, so in an effort to contain the spread, if it is out there, we are making sure that all patient encounters, whether they're just wellness visits or even sick visits, we do as many of those as we can, either over the phone, over Skype, over Zoom, FaceTime, because we don't want to expose our healthcare workers or other people in the facility, other patients, to those germs if we can help it. And so we are making a concerted effort to call all of our patients who are on our schedule and say, we'd like to do this over the phone or telehealth if we can, unless there's something specific that we need to see you for, like a wound, or we need to take out sutures, things like that. There's some things that we have to do, like we have to continue on with our cancer surgery or cancer procedures. If someone has something that's bleeding, we have to tend to that. But all elective procedures we're postponing for now. So that includes screening procedures like screening colonoscopies, routine surgeries that won't affect the patient's health if we can postpone those.